Hello again, everyone. This is Dennis McCarthy with Upper Allegheny Health System and Olean General Hospital, welcoming you to Inside Olean General Hospital, a news and information program about our hospital and the community. With us today is Tim Finan, President and CEO of Olean General Hospital and Upper Allegheny Health System. Welcome, Tim.
Thanks, Dennis.
We want to talk, before we get into some of the other issues of the program today, our health system really just recently was awarded a really nice honor. Tim, you want to talk about what we are now in terms of we're most wired?
Yes, we're most wired. This week we were alerted by the American Hospital Association that for the second year in a row, Upper Allegheny Health System, Olean General, and Bradford Regional Medical Center were designated one of the most wired hospitals in the country for our use of technology to drive patient access and to improve quality and safety. We're the only hospital in the region to be so designated 2 years in a row, one of only two in Western New York, one of only two in Northwestern Pennsylvania, so it's quite an honor. And kudos to our information technology staff and all their wonderful work.
What a great team, and they really work hard to help make everybody else's job easier and really improve our standard of quality in our facilities.
Absolutely, and again, it's one of the things about Upper Allegheny that's so special, the fact that despite being out here in Olean and Bradford, we continue to do things that rival those of hospitals in much bigger locales.
And what a great advantage to the people who live in these communities. Tim, we wanted to talk a little bit today, really kind of the focus of the show, is to talk about some changes that are happening. You know, healthcare seems to be always about change, and why couldn't things just remain the same and hospitals be what they have been and always will be? But that's not possible anymore. Let's talk a little bit. We recently announced affiliation with Kaleida Health in Buffalo. But to get to the Kaleida situation, what happened just recently, you need to take us back a little further, maybe reverse the time clock back to 2009 and talk about the evolution of this system. So why is all this happening?
Well, you're right, Dennis. 7.5 years ago, we created the Upper Allegheny Health System, or the boards of directors of Olean General and Bradford Regional Medical Center created the Upper Allegheny Health System. And it's really all about being responsive to our mission. And I think everything starts with the mission of these two hospitals. So let me just talk about that a little bit. The mission of our hospitals is pretty basic. It's to respond to the healthcare needs of the communities we serve with high-quality clinical programs and services. That's been the mission of these two hospitals for the last 125, 130 years, depending on which hospital you're talking about. And in the process of fulfilling that mission, the hospitals provide 1,500 jobs in total. So not only are our hospitals first and foremost healthcare providers, but secondarily, and very importantly, they're also large employers, economic engines for this region. So the issue is, and our mission kind of mandates this, how do we keep these two hospitals not only viable, but vital and relevant? And so with that as kind of background and context, I think it goes a long ways towards explaining why Upper Allegheny Health System was created. So back in 2009, the two hospitals came together to create Upper Allegheny to drive really efficiencies and improve performance. The idea then was that there's strength in numbers, and that if we could share common administrative support, IT systems, that we could drive a lot of inefficiencies out of the system, be a more robust system. And in fact, since 2009, there's been $4 million of annual financial benefit that has accrued combined to these two hospitals. So now, 7.5 years down the road, we're realizing a $30 million benefit through the creation of Upper Allegheny Health System, again, since the beginning of the system.
So someone just didn't wake up one morning and say, you know, this is what we ought to do, and it's a great idea.
Yeah.
There was a reason behind it. Rural hospitals in this country and here face an uphill challenge, and I think we've talked about this before, that looking ahead into the future, status quo doing nothing was not an option back then and now.
Well, you're right, Dennis. And, I really applaud the board and the leadership of the boards of both these hospitals in terms of the creation of Upper Allegheny Health System. Again, the boards of our hospitals understand that these hospitals are absolutely essential to the quality of life of the Bradford and Olean communities. And it's not about, the mission is not about control. The mission is about ensuring access, assuring that these providers, these two healthcare providers, these two hospitals remain viable. In terms of rural hospitals, you're absolutely right. Tough road to hoe in 2015, because I don't know what the figures are for 2016, but more rural hospitals closed in America in 2015 than in the prior 15 years combined. And I often say to our employees that, believe it or not, rural hospitals are going the way of the company store. They're going the way of the dinosaur. They are absolutely, positively an endangered species. And our job here in Olean and here in Bradford is to keep these two hospitals alive and kicking. Not only alive and kicking, but prospering, for the sake of the 185,000 people that we serve in the combined service area of Olean and Bradford.
That's a heck of a mission, and a lot on everyone's shoulders. The doctors, the nurses, yourself, your team, to keep reading. You have to read ahead. You can't just say tomorrow. Here's what we're going to need tomorrow. In the hospital business, you have to project out to figure out what's it going to look like in 3 years, 2 years, 5 years.
And to that point, Dennis, a year or two ago, we took a 5-year look out into the future. And I think it's probably one of the best things we ever did. Sometimes we get so focused on the here and now that we don't look out down the road. And we extrapolated based on our utilization trends and our reimbursement trends. And we found out that without things changing, we would have an $18 million to $20 million annual shortfall. And we said, holy mackerel, we have got to start solving for that now. So we undertook an internal process that we called our transformation management agenda. And it was all aimed at trying to solve for this $18 to $20 million issue 5 years out. And we enlisted the support of some outside consultants. We had a lot of people internally looking at things. And we were able to solve for half of the problem 5 years out. And the realization was that Upper Allegheny wasn't big enough to solve for the entirety of this future problem. And that's what really prompted the thinking about the affiliation with Kaleida. Now, why Kaleida? Well, we had a wonderful relationship and experience with Kaleida by virtue of the cardiac catheterization laboratory that has been in Olean for the past 3 to 4 years and has really become a regional service, has saved a whole lot of lives, and has just been a wonderful collaborative partnership. So we knew Kaleida, we know Kaleida, good people to work with, we trusted them, and so we took it the next step in terms of proposing an affiliation with them.
Now that takes us back about a year or so ago. That was back in May of last year
right.
that we announced that we intended to affiliate. As of now, we are affiliated. That's all completed.
Right.
So what are going to be the advantages for us, maybe for Kaleida too, as we move forward? What's the good news for people who live here, for our patients, the people that we serve?
Well, good question, Dennis. Kaleida has phenomenal clinical bandwidth. It is an exceptional, underline, repeat, an exceptional provider of healthcare. Cutting edge, phenomenal clinical bandwidth, 500 residents and fellows in training in the Kaleida system. So under the terms of this agreement, and maybe I should just speak to that, a member of the Upper Allegheny board will be on the Kaleida board. They are going to provide the Olean and Bradford area with 8 to 10 physicians of our choice over the next 2 years to help us with physician recruiting. Kaleida is going to also utilize our Upper Allegheny healthcare capabilities in finance, in the business office, in information technology on behalf of their other regional affiliates, specifically Cuba, Brooks Memorial in Dunkirk, and TLC in Irving. And so that we will be able to derive a revenue stream by virtue of leveraging the Upper Allegheny platform. But overall, the opportunity to do joint purchasing with Kaleida, the opportunity to share in all sorts of non-labor expense savings is going to be financially very, very advantageous for Olean and Bradford, and really kind of keep us in the game and hedge against these unfortunate dynamics that are adversely impacting rural hospitals everywhere.
So we know that this affiliation is good news. Certainly, hospitals have to operate on a financial base. When that gets in jeopardy, things have to be done to change it. This is going to help that,
Right.
Help ensure the future. Let's talk a little bit about how the public may see some additions in physicians. They're going to work with us. First of all, I'll talk about physician recruitment. And rural hospitals, it's a tougher place to find doctors to come.
Yeah.
And we need that because the medical staff is aging, and we're going to need more of them. So
Right.
and this is going to help that.
Well, yeah, clearly. First, I want to say that Olean and Bradford, I think, have done a wonderful job recruiting physicians. We have a very effective physician recruitment arm within our hospitals. But, when we recruit a physician, or get a physician interested in Olean or Bradford, we many times have to find a job for their husband or wife or significant other. That sometimes is a challenging situation. So we're not only selling the hospitals to the physician, but also to the other member of the family. And the other issue is that physicians, there's a national demand for physicians. So the question is, why Olean and why Bradford? Why should I come to Olean and why should I come to Bradford? Well, we have to be able to make that case, and we make that case in terms of clinical bandwidth, our programs and services, collegiality within the medical staff, quality of life here in our area with respect to, housing and safe neighborhoods and good schools and close to big cities to the extent you want to get away and see a ball game or see a play or let's go to the Philharmonic. So I mean that's the pitch. But having Kaleida on our side now, this realization that we'll be able to impart to others that we're part of something bigger, and then being able to leverage Kaleida's very significant presence in medical education on our behalf, I think will help ensure that physicians fill our medical staff ranks for years to come.
We talked about Kaleida. Well, we haven't said who they are. Just talk a little bit about what facilities they represent, because people may not know the name, maybe, Kaleida Health, but certainly they recognize what's
Well, Kaleida is a large multi-hospital system based in Buffalo, New York. It consists of Buffalo General Medical Center, Children's Hospital of Buffalo, Millard Fillmore Suburban Hospital in Amherst, DeGraff Memorial Hospital in North Tonawanda, and also the Visiting Nurses Association of Western New York, which has a program down here in Cattaraugus County. And the Kaleida Health System also includes the Gates Vascular Institute, which is world-renowned, right, and which actually is the partner with our cardiac catheterization lab here in Olean.
And it's a very exciting system all on its own. If no one knows or hasn't been watching television, they're building a brand new children's hospital in Buffalo, which will be open I think soon.
The fall.
And so that will be a wonderful resource, which connected now to Upper Allegheny Health System and all our people. It's really is an exciting time for healthcare here. What will people notice about this affiliation? Is there anything that's going to jump out at them?
I don't think there's anything that's going to jump out. I think that what they'll appreciate is that we're going to remain viable and vital and relevant, and we're not going to have an erosion of programs and just kind of a wearing down of these hospitals.
The names of the hospitals are going to remain.
The hospitals are going to stay the same. The employees are going to stay employees of the respective hospitals.
Our foundation boards?
Our foundations, thank you, Dennis. You're prompting me very well. Our foundations will remain separate and independent and supportive of the two respective hospitals. And so, we want to stay in this game. They're great partners, good people, well-run organization, very, very respectful of the fact that rural knows rural best. So we're looking forward to the partnership. One of the issues, Dennis, that I wanted to mention, and as I say to staff many times, what you really need to understand about hospital finance and the dynamic that is so problematic to hospitals everywhere is the fact that year in and year out, our expenses are going up 3%. What we pay for utilities, what we pay for pharmaceuticals, what we pay for supplies, what we pay for salaries, and yet our rates of payment in the aggregate from Medicare and Medicaid and Blue Cross and United and Aetna only going up 1.5%. So expenses up 3%, revenue up 1.5%. That delta of 1.5% on a $185 million a year business is worth almost $2.7 million a year, meaning that when the clock strikes 12 on December 31st at the end of the year, as we come out of the blocks into the new year, we're already $2.7 million in the hole. The fact that Olean has been profitable for 9 of the last 10 years and Bradford has been profitable from operations 5 of the last 6 years is really phenomenal in light of that dynamic. But there's only so many years you can arm wrestle that before you have to kind of think outside the box. And that's what resulted in our affiliation. And I need to add too, Dennis, that 65% of the hospitals in this country are part of larger hospital systems. So we're certainly not blazing new trail here.
No, but we're walking the right trail, it would seem. And more to come. It seems, we talked a little bit earlier about even some of the newer programs that we're looking at soon with connected, maybe a spine center and some neurovascular capabilities. So
yeah, some neurosurgery here in Olean, back surgery. When I say neurosurgery, I'm referring to back surgery specifically, which is incredibly exciting. I mean, that's a capability we have never had in our history. We're looking at vascular, big vascular surgery program here. And this all is coming about by virtue of leveraging Callida's capabilities on behalf of our 2 hospitals down here.
Well, I think, for the communities that these hospitals serve, that's nothing but good news. It sounds like keeping healthcare local, keeping it at home, maybe limiting the need to travel far places to get things done. So
yes.
It's a compliment to you and the team and the board of directors, and certainly more things to come. Did we forget anything today?
I don't think so, Dennis. I think we covered it all.
Well, Tim, it's been a pleasure having you with us today, and thank you for all that great information. Certainly an exciting time for our hospitals and for Olean and Bradford.
Thanks, Dennis.
This is Dennis McCarthy with Upper Allegheny Health System. That's all for this time. Thank you for being with us. If you'd like more information, go to our website at www.ogh.org. Have a great day.